How do body planes compare to anatomical sections? Have you ever wondered how we can describe the human body in such precise terms? The answer lies in understanding body planes and anatomical sections. Let's break it down together. Body planes are imaginary flat surfaces that help us divide the body into specific parts. They serve as reference points for describing where things are located. The main body planes include the sagittal, coronal, and transverse planes. Each of these planes divides the body differently. The sagittal plane splits the body into left and right portions. If you were to draw a line down the center of your body, that would be the sagittal plane. The coronal plane, also known as the frontal plane, divides the body into front and back sections. Imagine standing against a wall. The plane that separates your face from your back is the coronal plane. Lastly, the transverse plane separates the body into upper and lower parts. Think of it as a horizontal cut across your waist. Now, anatomical sections are the actual cuts or slices made through the body or an organ along these planes. When we make a cut along a specific plane, we get what is called an anatomical section. For instance, a cut along the sagittal plane gives us a sagittal section, showing us a side view of the body. On the other hand, a cut along the transverse plane results in a cross-sectional view, which can be very helpful in medical imaging. So, in simple terms, body planes are the conceptual lines we use to describe locations and orientations, while anatomical sections are the physical results of making cuts along those planes. This distinction is vital for anyone studying human anatomy. It helps us visualize and describe how organs and systems relate to one another. From a practical standpoint, understanding these concepts is essential in fields like medical imaging. Techniques such as magnetic resonance imaging and computed tomography relying on viewing the body in different planes. For example, a transverse section can reveal the internal layout of the abdomen, while a sagittal section can provide a side view of the brain or spine. To recap the main planes, the sagittal plane divides the body into left and right sides, the coronal plane divides it into front and back, and the transverse plane divides it into top and bottom. There is also an oblique plane that cuts at an angle, which can be useful for viewing complex structures. In summary, body planes give us a framework for understanding anatomical sections, which are the actual slices we use to study the body. This foundational knowledge is key to clear communication in anatomy and clinical practice. Understanding these concepts can greatly assist in learning about human anatomy and its functions.